What's up, guys? My name is Aaron. This is going to be my first video on my channel. I've never made a channel before. This will be the first time, so it's kind of new for me. The reason why I'm actually doing this video, okay, and making this channel is not because of the money and the fame and all whatnot. You know how the YouTubers nowadays, they're like the superstars, you know what I mean? I'm actually doing it because I want to help people. The reason why is because not only do I want to help people, but I was actually helped and through YouTube personally. I don't know what this channel is going to be about. It could be about anything, okay? It's just going to be a random channel. Today, okay, is a very special day. Let me tell you why. I don't know if you guys have ever experienced any kind of chest pain. I'm 28 years old, okay? I'm fairly healthy. Had some, injuries back in the past, but not too bad. A couple car accidents. Anyways, the reason why I'm doing this video is because I'm going to explain a little bit about costochondritis, okay? And what costochondritis is actually the inflammation between your joints and the rib cage. So you have here. I actually got a little picture here for you guys. I didn't take too much time on this, but okay. So right here, if I hold this still, costochondritis. Okay, and what you have is here's some of the symptoms. Okay, symptoms of costochondritis is you have sharp stabbing pain in chest, pain when taking a deep breath. So when you take a deep breath and you expand this rib cage along with the diaphragm, what it does is it creates pressure, and it actually almost feels like something's being crushed inside your chest. And then you have neck, upper, and back pain, which is real common, tenderness and swelling, and then sometimes you'll get a headache. Okay, now what costochondritis actually is an inflammation of the cartilage at the rib cage and the breastbone joint. Okay, so here's a little diagram right here. Here's your collarbone, here's your ribs, here's your sternum, and I circled the part right here, and what that actually is between your sternum and the rib cage, there's cartilage right here. Same cartilage that's on your nose, your ears, all that kind of stuff. So here's a better look. If you zoom in, this is the cartilage right here. This is your costochondral junction right here. That's actually where the joint, where the ribs and the actual and the sternum connect, okay, and then this is obviously your bone. So what happens is this area right here gets inflamed, okay, and the reason why, some of the causes of getting, inflamed is there could be a number of reasons. There could be a bacterial infection, it could be stress on those joints, it could be lifting something heavy, an injury. There's, quite a few reasons on why it could actually get swollen and get inflamed. A lot of people mistake this as being a heart attack. The symptoms are almost exactly identical, and let me just tell you the reason why I know that. The other night I was having the same pain, and I ended up having to go to the emergency room. Okay, and that was really a scary experience. I started, experiencing chest pain. Started sweating a little bit, and it was really just a rough deal on me. And I ended up taking myself to the emergency room. And I got treated, everything was fine. I went in there, they did a bunch of blood work. Let me set you guys down real quick. They did a bunch of blood work, and nothing came back bad. It was all good. My heart was healthy, all my blood work was fine. I had an overactive thyroid, which ain't a big deal, but it's something that I could deal with. So I guess my whole point of the story is I'm young, I'm 28. I've never experienced chest pain like this, and it's very, very scary to have chest pain. I'm sure you guys have either had it or know somebody that has, but let's just say that it's not a heart attack. Now, let me mind you, this is all for educational purposes. I'm not a doctor, okay, but let me just tell you one thing. It's not guaranteed that it's not a heart attack. There could be underlying, heart problems that people are having or that runs in the family. That's why you need to go get it checked out. Don't ever, ever ignore chest pain. Chest pain is very important no matter what it is. So I would just advise you to look into it if you guys are experiencing chest pain, mainly on the left side. It can radiate to the right, but a lot of it's on the left side, which is where your heart is, and that's, scary. So if you have anxiety, stress, those things too, obviously, are going to have a big role on your chest pain. But for the most part, I hope you guys enjoyed the video. I don't know how they do this, but give it a thumbs up and subscribe. Is that what they do? Okay. Anyways, I'm not real good at this yet, but I appreciate your guys' time, and hopefully this helped a little bit. All right, thanks.